Hi folks, Steve the Hurricane here, and for today's episode of A Drink with the Hurricane, we are going to talk about specializing in COVID-19. Should you do it or should you not? Cheers. A Drink with the Hurricane, the home care sales and marketing talk show that discusses all things growing your home care business. All right, so you're looking at this video right now, you're watching it, and you see my hair is longer than it usually is. I live in New Jersey. New Jersey is the second hardest hit state in the United States outside of New York State, and we have over 150,000 cases, over 11,000 have passed away here in my home state of New Jersey. So I can't get my hair cut like I normally would, and you know what? There are people suffering out there. I'm not suffering. I can deal with long hair right now, right? But I had to share this with you because as part of the hurricane coaching program, we teach our clients how to create specialty programs that differentiate their business from all of their competitors so that they have a competitive advantage, which helps them to scale and grow their business faster than ever before. And as a result of that, many people have come up to me and said to me, Steve, should I create a COVID-19 specialty program and go market it the way that I would any other specialty program? And I've given it a lot of thought, and it sounds like a good idea, but I want to show you something here, some food for thought. So I'm sharing my screen here with you all, and you can see this right here. This website that I'm going to is Worldometers. Let me refresh it, make sure it's the most current, accurate stuff. All right, so this is the Worldometers coronavirus count, and I have it specifically opened up to the United States. Worldwide, we're approaching 5 million cases. We have almost 2.5 million people who have made a full recovery. Here in the United States, we have over almost 2 million people who've had it. We've had 100,000 pass away, unfortunately, and we're almost at 500,000 people have made a full, complete recovery from it. Praise the Lord, right? But now you go down, you scroll further, and they give you the state-by-state breakdown. This is why I like this website so much, and I've been taking a look at it pretty much since it first started, just to see where the numbers are. And so in understanding that this is the total number of cases that have happened since the coronavirus, they started counting it. These are the new cases. Now, where you don't see one, that means they haven't updated it yet. It's only 11:30 in the morning when I'm filming this. So usually by the end of the day, they put their daily totals in from the day before and it'll update. You see the unfortunate, the lives lost over here. And it's interesting how some states did better than others, like California, which has almost 100,000 cases, only 3,000 deaths. But then you look at a state like Massachusetts, which had comparable, but they had twice as many deaths. So I'm not sure what causes that. That's not my area of expertise. But what I am taking a look at is just active cases, because these are the people who currently still are showing as have COVID-19. And let's go a little bit further down here where they show you, they used to show you, they don't show it anymore. They used to show you critical care. So they're not showing critical care anymore. I guess they've taken that part down. It used to be up here. But regardless, you look at these active cases. All right. So an active case is a case that hasn't been closed out yet. Now, this is hard information to get. It's hard to gather because most people are being treated for COVID-19 at home. They're not in a medical setting where you can track it and you can train it and everything else. So this is why my professional recommendation would be to have a COVID-19 protocol in place for what you would do if you get a COVID-19 patient, but do not specialize in COVID-19. Because when you look at the top 10 leading causes of death, heart attack, heart conditions is #1 cause of death. Like 25% of all people who pass away will pass away from something cardiac related. The number of people who have died from heart disease in the last 2 months is almost 10 times who has died from COVID-19. So there's a lot more people with cardiac issues that need help than people with COVID-19. So again, have a procedure, have a protocol for COVID-19. Take the COVID-19 patient if that's what you wish to do. But do not make it your specialty program, because outside of New Jersey, and let's just look at New Jersey, right? There's 131 active cases, as this says, 131,000. So I got my calculator here. 131,000 people. Now, with 131,000 people, New Jersey has 21 counties. So I know it's not evenly spread. I know certain pockets, certain counties have 10 times the county numbers as other counties in the state. But just for easy math here, that comes out to 6,200 patients per county here in New Jersey. And that's only if you're in New Jersey. You know, looking at a state like Texas, I have no idea how many counties are in Texas. 50? If you have 20,000 cases and you only have 50 counties, you're talking about 400 cases per county. How many of those 400 people are your target customer? Like, if they're in a nursing home, they're not going to get home care. If they're in a hospital, they're not going to get home care. So the vast majority of the seniors who have COVID are probably in a skilled setting. So even if half of these people were seniors, that's 200, and 80% of them are in in medical settings. So you're talking about 106, so 40 people are in the home setting, and how many of them are going to call you? It's not enough to make it your specialty program of choice for you to go out there and market it and get the business that comes with it. So what am I saying here? I'm saying have protocols for COVID-19. What are you going to do if somebody has it? How are you going to take care of that patient? Put all of that in place. Follow the guidelines of your state board of nursing. Follow the guidelines from the Center for Disease Control. But do not make this a specialty program where you're going to go do lunch and learns and in-services and everything else on it, because the number of people who are getting it, it's so few that you might cut off your nose to spite your face. Yeah, you're the COVID specialist, and you'll get a referral here and there, and that's it. And then you don't get the other referrals that we really need to grow our business and sustain our business for long term. Take care of the COVID-19 patients. Treat them. They're a patient. They're a person just like you and me. What they got, you got to help them. But don't make it your specialty of choice, because you run in the risk of having some issues. So now, folks, if you are not a client of ours, as part of my effort to help rebound the economy and help rebound the home care industry, I am giving away $50,000 worth of my company's services to you. All you have to do is say, I want a coaching session. And the coach, one of my esteemed coaches, I have 6 coaches, they will get on the phone with you, remote communicate with you the way I am right now, and help you get your marketing initiatives going in the right direction to get the referrals coming in absolutely free. I normally charge $250 for this. We're doing this for free for you as our way of giving back and helping out everybody to get back on their feet. So if you haven't had one yet, all you have to do is email info@homecaremarketing.net. That again is info@homecaremarketing.net, and we'll give you everything you need to blow away the competition.